Lignocaine. Lignocaine is a local anesthetic having antiarrhythmic activity. Lignocaine is a local anesthetic which has antiarrhythmic activity. It is a class 1B antiarrhythmic drug. Lignocaine is class 1B antiarrhythmic drug. Local anesthetic preparation of lignocaine contains methylparaben, a preservative, hence not used as antiarrhythmic agent. The local anesthetic preparation of lignocaine contains methylparaben, which is a preservative, hence not used as antiarrhythmic agent. The local anesthetic preparation is not used as antiarrhythmic agent because it contains methylparaben, which is a preservative. Pharmacological action: it blocks sodium channels in the inactivated, predominantly in the inactivated state and in the active states. Lignocaine blocks the sodium channel in the inactivated and active states. It has minimal effect on the cardiac tissue. Lignocaine has minimal effect on the normal cardiac tissues. Its effect is prominent in depolarized tissue. So it has prominent effect in the depolarized or ischemic tissues. Lignocaine has minimal effect on the normal cardiac tissue. Its effect is prominent on the depolarized or ischemic tissues. It decreases the automaticity of the ectopic foci by reducing the slope of phase 4 depolarization and depresses conduction in depolarized tissue. So lignocaine, it blocks sodium channel in the inactivated state mainly and also in the active states. It has minimal action on the normal cardiac tissue. Its effect is predominant in the depolarized or ischemic tissues. It decreases the automaticity of the ectopic foci by reducing the slope of phase 4 depolarization. ये phase 4 depolarization के slope को reduce करता है and thus decreases the automaticity. Lignocaine decreases the automaticity of the ectopic foci by reducing the slope of phase 4 depolarization and it depresses conduction in the depolarized tissue. ठीक है, ये automaticity को reduce करता है, slope phase 4 के slope को reduce करता है. ठीक है, phase 4 depolarization का phase 4 depolarization के slope को reduce करता है and thus decreases automaticity. ये conduction को depress करता है in the depolarized or diseased tissue. Action potential duration is usually unaffected. जो action potential का duration है that is usually unaffected or may be shortened. Action potential का duration generally unaffected होता है but it can be shortened. So lignocaine is a local anesthetic which has antiarrhythmic activity. It belongs to class 1B antiarrhythmic drug. Local anesthetic preparation of lignocaine contains methylparaben. The local anesthetic preparation contains methylparaben, which is a preservative. Hence, it is not used as antiarrhythmic agent. It blocks the sodium channels in inactivated and active states. It has minimal effect on the normal cardiac tissue. Its effect is prominent in the depolarized or ischemic tissues. It decreases automaticity of the ectopic foci by reducing the slope of phase 4 depolarization and it decreases the conduction in depolarized tissue. Action potential duration is usually unaffected or it may be shortened. तो ये automaticity को decrease करता है और conduction को depress करता है. Pharmacokinetics: lignocaine is orally not effective because of extensive first pass metabolism. So lignocaine का first pass metabolism बहुत ज़्यादा होता है, that's why it is orally ineffective. Lignocaine is therefore commonly administered by intravenous route as an antiarrhythmic. As an antiarrhythmic, it is given in intravenous route. It is widely distributed in the body. It readily crosses blood-brain barrier, poorly bound to the plasma protein. Widely distributed, poorly bound to the plasma protein, and it readily crosses blood-brain barrier. Rapidly metabolized in the liver, has short plasma half-life of 1 to 2 hours. तो लिग्नोकेन का फर्स्ट पास मेटाबॉलिज्म बहुत ज़्यादा होता है, दैट्स वाई इट इज़ ओरली नॉट इफेक्टिव. एंटी एरिथमिक एजेंट के तौर पे इसको इंट्रावीनसली देते हैं. वाइडली डिस्ट्रीब्यूटेड इन द बॉडी, पुअरली बाउंड टू प्लाज्मा प्रोटीन. ठीक है, वाइडली डिस्ट्रीब्यूटेड, पुअरली बाउंड टू प्लाज्मा प्रोटीन, metabolized in the liver, has a short plasma half-life of 1 to 2 hours. The volume of distribution and hepatic clearance of lignocaine are reduced in patients with heart failure. Hence, both the loading and maintenance dose should be decreased. So, heart failure के patients में lignocaine का loading dose और maintenance dose should be decreased. क्यों? क्योंकि हार्ट फेलियर के पेशेंट्स में लिग्नोकेन का वॉल्यूम ऑफ डिस्ट्रीब्यूशन और हेपाटिक क्लियरेंस कम हो जाता है. लिग्नोकेन का वॉल्यूम ऑफ डिस्ट्रीब्यूशन और हेपाटिक क्लियरेंस इज रिड्यूस्ड इन पेशेंट ऑफ हार्ट फेलियर. दैट्स वाई बोथ द लोडिंग डोज एंड मेंटेनेंस डोज शुड बी डिक्रीज्ड. इन हेपाटिक डिजीजेस द क्लियरेंस ऑफ लिग्नोकेन इज रिड्यूस, हेंस इट रिक्वायर्स अ रिडक्शन इन द मेंटेनेंस डोज. हेपाटिक फेलियर में लोडिंग डोज, मेंटेनेंस डोज दोनों को डिक्रीज़ करना है. हार्ट फेलियर में लोडिंग डोज, मेंटेनेंस डोज दोनों को डिक्रीज़ करना है. हेपाटिक फेलियर में मेंटेनेंस डोज को डिक्रीज़ करना है. हार्ट फेलियर में लोडिंग, मेंटेनेंस डोज को कम करना है, और हेपाटिक डिजीज़ में मेंटेनेंस डोज को कम करना है. ड्रग इंटरैक्शन लिग्नोकेन एक्स प्रोपेनोलॉल. Propanolol reduces lignocaine elimination. Propanolol reduces lignocaine elimination by reducing the hepatic blood flow, thus increases the risk of lignocaine toxicity. Propanolol के कारण lignocaine का elimination reduce होता है. Propanolol hepatic blood flow को reduce करता है, जिसके कारण लिग्नोकेन का एलिमिनेशन रिड्यूस होता है. प्रोपानोलॉल के कारण हेपाटिक ब्लड फ्लो रिड्यूस होगा, उसके कारण लिग्नोकेन का एलिमिनेशन रिड्यूस होगा, एंड दस इंक्रीजेस द रिस्क ऑफ लिग्नोकेन टॉक्सिसिटी. एडवर्स इफेक्ट. These are mainly related to the central nervous system, like headache, drowsiness, nystagmus, blurred vision, confusion, muscle twitching and convulsion. In high doses, lignocaine may cause hypotension due to myocardial depression. Side effects are potentiated in renal and hepatic failure. तो लिग्नोकेन का जो भी एडवर्स इफेक्ट है दैट इज़ मेनली रिलेटेड टू CNS, जैसे कि कन्फ्यूजन, हेडेक, ड्राउजीनेस, निस्टैग्मस, ब्लर्ड विजन, मसल ट्विचिंग एंड कन्वल्शंस. Headache, drowsiness, confusion, convulsions, muscle twitching, blood vision and nystagmus. Headache, drowsiness, nystagmus, blood vision, confusion, convulsions and muscle twitching. High doses में लिग्नोकेन के कारण हाइपोटेंशन हो सकता है बिकॉज ऑफ मायोकार्डियल डिप्रेशन. हाई डोज में लिग्नोकेन के कारण मायोकार्डियल डिप्रेशन होगा, जिसके कारण हाइपोटेंशन हो सकता है. These side effects are potentiated in renal and hepatic failure. Let's see the uses of lignocaine. Lignocaine is used for emergency treatment of ventricular arrhythmias associated with MI, digitalis toxicity and cardiac surgery. So, emergency treatment of ventricular arrhythmias के लिए use होता है. Lignocaine is used for the emergency cases of ventricular arrhythmia, for the emergency treatment of ventricular arrhythmias which can be associated to MI, digitalis toxicity and cardiac surgery. MI digitalis टॉक्सिसिटी या कार्डियक सर्जरी के कारण वेंट्रिकुलर एरिथमियाज हो सकते हैं, उनको उनके ट्रीटमेंट में लिग्नोकेन इज यूज्ड. Lignocaine is preferred in ventricular arrhythmias. Why? Because it is relatively less toxic. Lignocaine is relatively less toxic, has a rapid onset and short duration of action. So its action wears off immediately after stopping the infusion. Less toxic, rapid onset and short duration of action. That's why its action wears off after stopping the infusion. It has no action on the EV nodal conduction velocity, hence does not intensify the EV block during the treatment of ventricular arrhythmias in digitalis toxicity. So लिग्नोकेन को हम ventricular arrhythmias में प्रेफर करते हैं क्योंकि they are less toxic, they have a rapid onset and short duration of action. Less toxic, rapid onset and short duration of action, so its action wears off immediately after stopping the infusion. It has no action on EV nodal conduction velocity. It has no action on EV nodal conduction velocity and thus does not intensify the EV block. ठीक है, ये EV node conduction velocity को इसका कोई एक्शन नहीं होता है, so it does not intensify the EV block during the treatment of ventricular arrhythmias and digitalis toxin. So lignocaine is used for the emergency treatment of ventricular arrhythmias because they are less toxic, rapid onset, short action, does not intensify the EV nodal block. Lignocaine is administered intravenously, initially as a bolus 1 to 2 mg per kg and later 1 to 4 mg per minute IV infusion as maintenance dose. तो लिग्नोकेन का पहले लोडिंग डोज देते हैं, ठीक है. सो दैट इज़ बोलस 1 to 2 mg per kg और उसके बाद मेंटेनेंस डोज विल बी 1 to 4 mg per minute IV इन्फ्यूजन एज मेंटेनेंस डोज, ठीक है. तो लिग्नोकेन के लिए लोडिंग डोज होता है, तो लिग्नोकेन को पहले लोडिंग डोज देंगे, दैट इज़ इंट्रावीनस बोलस ऑफ 1 to 2 mg per kg. उसके बाद इसका मेंटेनेंस डोज होता है 1 to 4 mg per minute IV infusion is the maintenance dose. Lignocaine is not useful in arterial arrhythmias. Arterial arrhythmias में इसको यूज़ नहीं करते because arterial action potential are of very short duration. So the Na plus channels are in the inactivated state for a very brief period of time. लिग्नोकेन को हम वेंट्रिकुलर एरिथमियाज में यूज़ करते हैं. इसका लोडिंग डोज होता है दैट इज़ बोलस, IV बोलस 1 to 2 mg per kg. उसके बाद मेंटेनेंस डोज देते हैं ऑफ 1 to 4 mg per minute IV इन्फ्यूजन. लिग्नोकेन को हम आर्ट्रियल एरिथमियाज में यूज़ नहीं करते. क्यों? क्योंकि आर्ट्रियल एक्शन पोटेंशियल आर ऑफ वेरी शॉर्ट ड्यूरेशन. आर्ट्रियम का जो एक्शन पोटेंशियल होता है वो बहुत छोटे ड्यूरेशन का होता है. So the Na plus channels are in the inactivated state for a very brief period of time. तो लिग्नोकेन क्या करता था, ये Na plus channels को ब्लॉक करता है mainly in the inactivated state. आर्ट्रियल एक्शन पोटेंशियल में जो Na plus channels है वो inactivated state में बहुत कम टाइम के लिए रहते हैं. That's why they are not used in arterial arrhythmias because arterial action potential are of very short duration. So the Na plus channels are in the inactivated state for a very short time.